I am joined by two very special guests right now. Dr. Derek LeRoith of the Mount Sinai Hospital, who is the overall chair of ICE-ENDO, and Dr. Kevin Grove, who is the basic science chair of ICE-ENDO with Oregon Health and Science University. Gentlemen, thank you so much for being here. So, a pretty historic meeting, the first time ICE-ENDO together since 1996. Why is it important to meet jointly?
So we're very excited about this combined meeting because it brings the international community together with the American Endocrine Society. And while we've often had members of the international community, this really is a moment where we can bring their knowledge and our knowledge together, and this is very important. There's certain aspects of the endocrinology in the world that are slightly different from what we see as well. There's specific aspects, whether it's in Africa or in Asia, for example in diabetes and obesity, and you'll hear about that, but this brings the whole community together.
And sharing that information can certainly help us all as patients and as physicians.
Right, and to understand the disease more clearly.
So you have some new offerings this year that I know you're very excited about.
Yes, we were trying to expand the interaction and engagement of the basic scientists. So this year we were offering a couple of new programs. One is the involvement, a more active involvement of the National Institutes of Health. And so we have several of the NIH funding agencies here. This will give the scientists, and especially the young scientists, an opportunity to directly interact with these institutes and to hear about some of the new funding initiatives. It's a tight funding environment out there, and so we want to improve that opportunity. But we've also invited some of the European funding agencies as well, so our international contingents will also be serviced as well. And we also have a new exciting program, Big Data, and it's an opportunity for scientists to learn how to use some of these free, public, large databases to more effectively and efficiently use their research dollars. And that'll be something that'll be continued in coming years as well.
It's certainly incentive for people, for sure. Talk to me about what the biggest challenges are right now facing endocrinology.
Well, there are two aspects. We have the science, the basic science, the research, and of course we have the clinicians as well. And so the basic science, we have funding issues. The major issue, of course, is people either who have grants, getting their grants renewed, and more importantly are the young people. And so bringing them to this meeting and allowing them to interact with the NIH and other funding agencies, really we try to give them an idea that there is a future in endocrinology, because many are turning away from the basic science because of the concern about funding. From the clinical side, I think the endocrinologists have their problems in terms of patient care, healthcare organizations, Medicaid and Medicare, and those are other issues that they have to deal with. And the advantage of this meeting is that we cater for everybody. We cater for the clinician, the basic scientist, the student, the postdoc, the fellow, for everybody. We also cover a broad range. We cover from reproductive endocrinology to what you've heard about obesity and diabetes. We cover all range of endocrinology.
A wide range of people certainly attending this event. What would you like them to take away from it?
I think there's some new exciting programs. There's a big focus on new obesity therapies, but the society covers a broad spectrum of endocrine issues as Derek has outlined, and so we've really tried to build a broad breadth of symposia and plenaries and presentations to service the full spectrum, and it's an exciting meeting.
Dr. Grove, Dr. LeRoith, thank you so much for being here, and congratulations on a really wonderful conference.
Thank you.
Thank you.